in place ahead of the launch of public inoculations later this month. Now, we have more on this measure and the upcoming inoculation campaign later on in the program. Here first is our Consua with the broader pandemic updates. Now, so here on the local front, there has been a slight decline on the back of fewer testings, I hear.
Right, Sunny, that too. And despite the lower number of infections, we are still seeing outbreaks at multiple locations. But it is good to see a drop. We now have cases in the low 300s. And also the number of domestic transmissions has now dropped to below 300. And that's happened for the first time since November 23rd. And with that, the total number of infections in Korea stands at 78,508. We have a single-digit rise in fatalities. And around 70% of Monday's cases have occurred in the metropolitan region, with 107 in the capital, where there have been outbreaks at major hospitals, as well as new infections among homeless people. And then there also have been sporadic infections related to a missionary training center, as well as infections that are untraceable.
Right, so and against that backdrop, the government has decided to extend social restrictions for another 2 weeks.
That's right, Sunny, which means level 2.5 in the greater Seoul area and level 2 in the rest of the nation. And that will be right until the end of the Lunar New Year holiday. Also, the ban on gatherings of 5 or more people, private gatherings, I should say, has also been extended, with authorities calling on the nation's people to refrain from meeting with their family members and relatives over the holidays. Slight adjustments have been made at certain venues, including an easing of seating restrictions at theaters and concert halls, and partial reopenings of shower booths at indoor sports facilities. Also, ski resorts are now allowed to open after 9 p.m. However, dining in at restaurants and coffee shops remains forbidden after 9 p.m. That was actually something that business owners were hoping for, or at least operating times to be extended for at least another hour. While the government aims to prevent further spreads before vaccination begins and also before the new school year begins, there is still room for possible changes.
We will monitor this week's developments, and if we become confident that the situation has definitely stabilized, we will carefully review the additional easing of our disease prevention measures.
Now, where easing remains out of the question is the U.S. Something that's been normal for months here in Korea has now become mandatory in the U.S., meaning the wearing of face masks, and especially at public transportations, as well as transportation hubs such as airports and seaports. Now, we are, however, seeing a decline in infections in the U.S. as over the weekend, for the first time in months, the daily number of infections has dropped to below 100,000. But if we go over to our next table now, the U.S. is still dealing with a problem in fatality numbers, especially as January was the worst month for the U.S. when it comes to the number of deaths, and followed by Brazil with over 221,000 fatalities in total. And the total number of infections around the world now stands at 103.5 million. Those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Now, staying on the international front, a nighttime curfew aimed at containing COVID-19 in the Netherlands is fueling public protests that look to spread throughout Europe amid frustration amounting over lockdowns. For more on the situation there, I have Tessa Lagerman live on the line. Welcome, Tessa.
Hello.
Please start by telling us more about the decision to implement this curfew despite weeks of subtle declines in new cases in the Netherlands.
Yeah, so we are a small country with a population of 17 million people. And the total number of COVID-19 infections is around 975,000 now. And the total number of deaths are almost 14,000. And the numbers of infections have luckily been slowly dropping since the end of December, when there were more than 12,000 cases per day. And in the past few days, around 4,000 people have been tested positively per day. But right now, 1 in 3 infections is of the British virus variant, and the South African and some of the Brazilian variants have been found here as well. Regarding the measures that are in place now, cafes and restaurants have been closed since October. Shops, except for food, have been closed since mid-December. Also, the schools and daycare centers are closed. Museums, gyms, swimming pools. And the advice is not to receive more than one visitor per day at home and to work from home, although still many people don't. It's also advised not to travel abroad until at least the end of March. And like you said, an evening clock has been imposed since 23 January.
I see. And going back to that curfew, like I mentioned, Tessa, the recent riotings there in the Netherlands have been described as the worst violence in more than 4 decades. Is it simply because of the stringent COVID-19 restrictions, or are these riots being fueled by other factors here?
Well, yeah, there had been demonstrations against the measures before, but now it's been much larger and quite violent at some places. But yeah, this happened after the evening clock, this decision to impose an evening clock. So that was the trigger. So yeah, many people went out on the streets after 9 when the evening clock was in place. And yeah, people also destroyed and looted shops, a railway station, and a COVID-19 test location was set on fire. Yeah, some of these protesters believe that COVID-19 is just like influenza, not that dangerous, and they are against all the regulations. And I think also many people are just fed up with the situation, the fact that there's so little to do and the situation seems hopeless. And I also read that when there has been a pandemic in history, there have always been protests or even riots as well. This is perhaps not something surprising.
Right, Tessa. How are authorities responding to the public unrest then?
Well, the government tries to explain that these measures are necessary right now because otherwise too many people will have to go to hospital and the intensive care and healthcare will not be able to cope. However, many people are also against the fact that the schools have been closed since mid-December for the second time. They are against this because of the disadvantages for children and parents. And tomorrow there will be a press conference by the government about the measures. They do this regularly. And we'll hear if the evening clock will be prolonged and the other measures. And it's already known that the schools will reopen again next week. So that's good news.
Right, some comfort there. Tessa, is the vaccination campaign in the Netherlands on track?
So far, around 350,000 people have been vaccinated. At first, the people who work in healthcare, next, the people living in nursery homes, then people who are over 19 years old and who live at home. This month, people between 90 and 60 years old can get vaccinated. And from May onwards, people between 18 and 60 years old. However, the parliament is critical about the fact that the Netherlands started to vaccinate only on 6 January, which is the last country in the European Union, and about the fact that it's going slowly. Apparently, too many people want to take a selfie, so that slows it down.
I see. Tessa, what is the latest with regard to mink infections of COVID-19? I believe more than 200 people there were infected with mink-related coronavirus as of late November last year.
Well, what I understood from government sources is that 70 mink farms in the Netherlands have been infected earlier last year. And at 2 of these farms, most probably 2 employees have been infected by the animals as well. And this was apparently another virus variant than the one found among minks in Denmark, where the situation has been worse. And by now, all infected minks in the Netherlands have been killed, and the others too by now for their fur. So all the mink farms are empty since December.
All right, Tessa, I'll have to cut our interview short right now because we have the regular briefing here in Korea starting. Thank you very much for your time, Tessa.
You're welcome.
Right now, like I said, the regular briefing has started. We'll come back to you afterwards.
As of today midnight, we have 285 new local infections and 20 new imported cases. The total caseload now stands at 78,508. And yesterday, a total of 33,000 tests were conducted. And we have 225 patients with critical or severe conditions, and we had 5 additional fatalities, with the accumulated death toll now standing at 1,425. The fatality rate stands at 1.82%. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us first go over our update on domestic infections. Yesterday, we had a total of 285 new local infections, 204 in the metropolitan area, which is more than 70%, and 81 in the non-metropolitan area. And in the metropolitan area, we have 204 cases, as we mentioned, and we have seen the 244 cases on a daily basis for the last week. A major cluster infections include University Hospital in Seoul's Seongdong-gu district. 47 have tested positive, and also in Dongdaemun-gu district, in relation to a hospital, we also have many cases being confirmed, and also in Seoul, 54 have been confirmed at a homeless shelter facility, and in Chungcheong area, we also have 8 new cases, and the daily average stands at about 17 for the past week. And major cluster infections include Cheongju City and Jeonbuk's Kimjae City. In relation to these two cities, we have the meat processing factory. A total of 54 have been confirmed. And Honam, we have 33 cases. And on a daily average, they have seen about 51 cases on a daily basis, which is slightly higher than other cities and provinces. And also, we have seen in Gwangju City a major cluster infection stemming from the IM mission group, as well as an adult game room. And especially for the IM mission group, we have about 203 people being confirmed. And we also have in Gwangju City churches as well as high schools being centers of the cluster. And also Gyeongnam area, we have 9 cases, and on a daily basis we have about 41 cases for the past week. And we also have the Gyeongnam University Hospital, which is on cohort quarantine, and a total of 84 people have been confirmed to date as of this cluster infection. And let us now go over our antivirus measures for the past week. Daily domestic infections for the past week, we have seen 424.3 cases, which is about 10.5% increase from the past week. And imported cases, we have seen about 27.3 cases, which is hovering around the 30 mark on a daily basis. And by region, we have seen a slight decline in the number of cases in the metropolitan area. However, it is over the threshold of level 2 social distancing, as we see about 243. However, in the non-metropolitan area, we are seeing a more increase of the cases, especially stemming from meat processing factory, the IM mission group, and also we had the largest on-day increase at Chungcheong and Honam area. And as for the major sources of infection, cluster infections were about 34%, and about 33.6% were stemming from contacts with previous confirmed cases, 7.1% stemming from hospitals and nursing hospitals, and about 600 cases, or about 24 cases, were unidentified sources of infection. And compared to the previous week, we have seen a slight increase of the proportion of the cluster infections, and we had 11 new cluster infections breaking out, and we also have seen 3, which includes the meat processing factory and the port and transport workers union. And also the number of patients with critical or severe conditions are also on a steady decline. However, we are seeing a steady rise in our fatality rate, which stands at 1.82%. And especially for those over the age of 80, the fatality rate is over 20%. So this is a very high. And also, we have many people among these COVID-19 patients, as well as the critically ill patients who are over the age of 80. 80, and we had about 70 or so fatalities for the past week, and about 53% were in their age group over the 80 age group. And also major sources of their infections were about 40% were stemming from their infections stemming from the hospitals and nursing hospital. And aside from one person, all of them had underlying illnesses. And next, we would like to provide you some updates on our latest findings of the COVID-19 new variants. And starting from last week, we have carried out analysis of 89 samples of the COVID-19 variants, and we have confirmed that 43 were infected in domestic infections. And also, as for the 46 imported cases, 6 cases were imported or variants. 4 were UK variants, and 1 is the South African variant, and 2 Brazilian variant. And out of these 7, 2 have been identified at the points of entry, and also the other people have been identified while on self-quarantine. And we have identified 34 new variants here in Korea. Most of them were the UK variants, 6 were South African, and also 5 were the Brazilian variant. And as for the influenza outbreak, we still see it's under the average threshold. And lately, stemming from the IM mission group, we have seen cluster infections stemming from the IM mission group to a non-accredited educational facility. And this has also overturned our situation around, and we are seeing a daily increase of our infections on a daily basis. So here are some risk factors. First, we are seeing increase of the cluster infections and also a very high risk of infection spreading during the Lunar New Year holidays. And we are seeing increased number of cluster infections as well as a daily tally. And also, we have also identified many hidden cases, especially after the mid-January as well. And also, during the Lunar New Year holiday, we have a very high risk as we would have increased foot traffic during these holidays. And to this end, the government has maintained the level 2.5 and level 2 in the metropolitan and the non-metropolitan areas, respectively, for the next 2 weeks. And we are also carrying out a special antivirus period for the Lunar New Year holidays. And we are also intensifying our antivirus measures for meat processing factories. And also at certain facilities, we are carrying out massive testings. And we also have still operation of the temporary test sightings. And also, we ask you to comply with the gathering ban of 5 or more people as far as the private gatherings. And also stay home and refrain from traveling during the Lunar New Year holiday. And second, we still have many risks of the virus spreading through the new variants. And we are seeing more countries reporting the new variants as well. And here in South Korea as well, we are seeing increase in the number of the new variants as well. And we also need to prepare for a possible local transmission of such new variants. And the government is still conducting intensified monitoring of those who are coming in from those countries that have reported such variants. And we are also conducting our analysis of the genetic sequence as well. And we also ask for your continued participation going forward. And as for the measure of the maintaining of our social distancing measure, this is largely aimed at having a downtrend of the virus spread ahead of the Lunar New Year holiday and also ahead of our massive inoculation plan. And we needed to also prepare ourselves for a reopening of the school as well. So we ask you to comply with such measures, including a ban on private gatherings of 5 or more people. And in order to prevent COVID-19, it is very important that you follow the following three factors. First, please avoid any social contacts and also stay home safe and sound. And also, as for all of the religious gatherings, please also have non-face-to-face means and as well. And also, when you are indoors or outdoors, please wear your face mask and please avoid any situations where you cannot wear a face mask, like smoking or consumption of food. And third, if you have any suspected symptoms like fever or respiratory symptoms, you need to get tested as soon as possible by visiting a nearby screening clinic. And next, we would like to provide you some updates on the preparations for the massive rollout of the vaccines. As for the vaccine procurement, through the COVAX facility, we will be having 117,000 doses of Pfizer vaccines, which is about the vaccine doses for 600,000 people. We will be also getting these by mid-February, and we will also have monitoring and the consultations by the experts as well, and we will have an exemptional special means of imports. And first target of our vaccines will be those who treat directly the COVID-19 patients, and to this end the government will also make all means possible to make a swift means of the inoculations as soon as these vaccine doses arrive in South Korea. And also through COVAX facility, we also have in place of about 2 million to 4 million doses of AstraZeneca's vaccine to arrive in South Korea, and the details will be provided as soon as possible. We have all of the data possible and prepared for you. And to this end, the National Medical Center is also preparing itself to carry out the vaccine center, and we also set up a special COVID-19 vaccination center, which is at the open space of the medical center, and we will also carry out the Pfizer's vaccine, which is the mRNA vaccine, and we will also carry out education for the other regional vaccination centers. And starting from today, we will have the special 누리집, which is the data set to reveal the COVID-19 vaccine, and this will be disclosed starting from today. Thank you very much.
Right, that was Chong Young with Monday's afternoon briefing. So, what did she have to say?
Well, let's start with what she just mentioned. The vaccination program, the planning is in full swing, including with where those vaccinations, at which locations they will be held. And she also mentioned that beginning today, the public will be provided with data on how the process is undergoing. And when it comes to cluster infections, here in the capital, Seoul, there have been a total of 47 infections related to a hospital, as 13 more were added this Monday. And the average number of domestic infections in the past week stood at 424. That's 10.5% up from the previous week. And especially outside of the metropolitan region, in the Chungcheong as well as the Honam regions, infections have been going up due to religious facilities, including the Missionary Training Center and also at a meat processing factory. And some updates on the variants from abroad. There have been genetic sequencing tests conducted on 89 cases, and 43 domestic infections did not, there were no variants detected in these domestic infections, while we have 46 infections from abroad in total. 34, that is, that are variants, 23 from the UK, 6 from South Africa, and 5 from Brazil. So these risk factors remain due to these variants as well as cluster infections ahead of the New Year's holiday.
Right, so right. Thank you very much for the summary. I'll see you tomorrow.
See you tomorrow.
In related news, Korea confirmed its first case of COVID-19 in a cat last month. Now, the pet reportedly caught the virus from its owners. We have details in this report.
Korea confirmed its first case of COVID-19 in a kitten, with the animal testing positive while under state custody, following the closure of a church where a recent cluster infection had broken out. The cat is now being treated under isolated care at a private shelter for homeless animals. Although it is possible for animals to contract COVID-19, their cases are often mild and asymptomatic, requiring a wide variety of testing methods.
검체 채취는 이제 코라든가 입이라든가 이쪽으로 이제 호흡기 분비물 있죠. 그 분비물을 면봉으로 채취를 해서 검사를 하는데 PCR 검사라는 검사 방법을 통해서 확진하게 됩니다. 그리고 이제 어떤 경우는 차이를 해서 항체 검사도 할 필요는 있습니다.
A total of 19 countries around the world have reported COVID-19 infections in animals as of November 2020. Of these, 321 cases were reported at mink farms and 135 cases in other animals, with cats being the most affected among household pets.
The fact that the cats are more likely to be infected than the other species has actually nothing to do with their numbers or popularities. When the researchers actually did their experiments with the animals, they figured out that certain domestic species seem to be more susceptible than the others, and it is not only the cats. In experimental studies, Syrian hamsters, ferrets, and cats are more likely to be infected by coronavirus, while the other species like dogs, pigs, and chickens were less likely.
With theories suggesting that the SARS-CoV-2 virus originated in bats and pangolins before being passed on to humans, is it possible for household pets to become a new intermediate host?
Theoretically, there is some chance of being like some reservoir host rather than, well, maybe just an immediate host, but reservoir host. But obviously, as I told you, this needs some rigorous investigation to say before saying whether it is possible or not. Like a variant, maybe just equal to the some more pathogenic, just the viruses. But that is not true. I mean, the viruses actually do mutate, but then they actually do mutate just depending on their just the environment, and then actually just the virus actually somehow they moved from the sort of just like a bat to the human. So it's a different the environment. So they do just to change or do just to mutate.
There are also mounting concerns over the possibility of cluster infections among farm animals. At one mink farm in the Netherlands, more than 200 animals were infected, along with a dozen human workers.
One dog to the next dog, or from one cat to the next cat. So we don't see these chains of infections occurring within pet populations. So in most cases, it seems very, very unlikely that dogs and cats will ever become an intermediate host of coronavirus.
So how are countries like the US and Australia preparing for the worst case scenario?
While the direct importation of animals into Australia, and particularly pets, is only permitted from New Zealand. So for a very, very long time, for decades, Australia's had a very strict quarantine system. This was originally created to stop the importation of rabid animals. So this quarantine period actually has worked very well in terms of coronavirus.
American Veterinary Medical Association, AVMA, came up with a recommendation for pet owners with support from CDC. You do need to wash your hands before and after you handle your animals, their food, waste, and supplies. Dogs should be kept on leash and maintained at least 6 feet from other animals and pets, just like how you would maintain social distancing with other people.
So what can Korea do to prevent cross-species contamination from animals to humans?
동물도 그리고 사람도 그리고 하니까 원헬스 개념이 작동되어서 이루어져야 되는 부분이고, 농장 동물에서 다른 동물이 이제 침입한다든가 이렇게 해서 접촉할 수 있는 그런 기회를 원천적으로 차단해야 되고요.
Korea's Agriculture Ministry is working with the country's health authorities to draft new safety guidelines for pet owners. New test kits are also being developed for use on household pets, which are now undergoing clinical trials. It is hoped that these measures can help protect our companion animals and put their owners at ease.
정부는 향후 2주간 현 거리두기 단계와 주요 방역 조치를 유지하기로 하였습니다. 5인 이상 사적 모임 금지 조치는 설 연휴까지 유지합니다.
코백스 퍼실리티를 통해 우리나라에 공급될 백신에 관한 공식 통보가 있었습니다. 이르면 2월 중순에 화이자 백신 11만 7천 도즈 약 6만 명분이 국내에 들어옵니다.
Authorities here have decided to maintain social distancing guidelines over the next 2 weeks to ensure an effective containment of the virus ahead of the launch of public inoculations this month. Now, for more on this, I have Professor Chung Gi-seok from Hallym University. Good to have you back, Professor Chung.
Good afternoon.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Thank you for having me.
Professor Chung, how do you assess the government's latest decision to further extend its social distancing?
Yeah, government decided to go for another 2 weeks until the end of Lunar New Year's holiday. I think it's, generally speaking, it's appropriate decision, but banning of gathering 5 or more people is a bit a strong measure, I suggest. But they have eased some restrictions, like you can take a shower in the indoor activities, and you can sit together with accompanying person in concert or in movies, and you can enjoy night skiing after 9 p.m. That's good. But generally speaking, it's appropriate. But the government announced that they will decide again on coming Sunday whether they could alleviate another restrictions or not. So we'll expect.
I see, so we'll have to wait and see then. Dr. Kwak, is the recent rise in cases here in the country simply the result of the cluster outbreaks at missionary training facilities, or is it an ominous sign of a new wave, as some are claiming?
Well, I tend to stay as conservative as I can. So I'm not going to just go out and say the numbers that are coming up these days are solely due to just cluster infections. Obviously, these are some of the numbers are the lagging tails of the huge third wave that we recently had. But we cannot ever take these cluster infections so lightly, because from these cluster infections, there's always the possibility of creating another seed to even cause further more cluster infections. So at this point, I don't think there's really a point in differentiating whether it is a ominous sign towards the future or not. We just need to take the most conservative approach to this as possible and take any single cluster infection or even a seed of an infection as carefully as possible.
Right. Professor Chung, staying with the tone set by Dr. Kwak, this very cautious tone, Korea's basic reproduction number has surpassed 1 again, and public movement over the past 2 weeks has been on the rise. Should we be concerned?
Yeah, it's a bit concerned. But as we know, the RO, which is reproduction rate, is a reflection of current increase or decrease. It's not a predictive parameter. So even though it is over 1, it cannot say that it will. We can see an increasing number in coming days or weeks. So it's just a reflection of current status. So let's not worry too much about that. But regarding traffic volume and increased movement is a big concern, because as we know, the traffic volume is quite correlated with increase of confirmed cases. It's from one of the studies. And another thing is the increased movement could lead to increased contact, and increased contact leads to spreading of infection. So the government and the people should be very cautious about increased movement these days.
Right. Dr. Kwak, our vaccine rollout, meanwhile, will begin later this month, as we said earlier on the program. What are some of the variables to keep in mind ahead of this event?
Well, some of the things, I think we're hearing from the sources in the United States that they want to emphasize the timing of this. If we want to get people vaccinated, it'll be best done if it is done in the quickest manner possible. But truth be told, I think we have a plan that's a few months spread out, beginning in possibly mid-February to, and they're talking the endpoint will be possibly sometime in November and whatnot. I also think that if we are planning to inoculate a certain percentage of the population, we have to do in as massive numbers as possible in the shortest amount of time as possible. Even still, having said that, we have to get our hands on whatever possible at this point. So whatever comes in, we will need to get the vaccination spread to the people that are in the most essential sector of the society. So I think that's good. Preparing for it, though, I think the government is doing relatively quite a good job because they're stating that they're planning to educate these people how they're going to inoculate these patients or customers. And they're also having different sites readily available so that people can actually come in and get the shots more efficiently. So in regards to the preparing for the vaccinations, I think we're on the right track.
What are your thoughts about the government's plan to vaccinate 70% of the population, I believe, by September in order to achieve herd immunity by November? Is this a feasible plan?
I would hope so. I would hope so. But as I said before, it's more important that we get this done in a timely manner, as quickly as possible. I'm actually hoping that it would be done, let's say, in the first half of the year rather than going into the second half of the year. But if it is only feasible that we can do it in the second half of the year, I'm suggesting that we should do it in the shortest time period. So if we were to begin, let's say, in June, we need to get it done, let's say, 2 to 3 months after June, but not spread it out, let's say, in the sense that we begin sometime in March and then end up in sometime in September. I think it'll be much better that we do it as quickly as possible.
And keeping this in mind, Professor Chung, what are your thoughts on efforts to encourage public participation in the vaccine campaign? Because if people decide not to get vaccinated, it would be really hard to achieve herd immunity in the first half.
I think that is the most important thing, because we have provided lots of vaccines so far. And even though the timing will be late, but we can provide and we can give them all the vaccines. But if one wouldn't like to get the vaccine, that's the real problem. So I would suggest that the very rapid and transparent opening of information, particularly the serious adverse events. And we heard lots of news, including fake news, that somebody has died from after getting vaccination. So the cause is the vaccine, or it's not the cause. It's very important, but generally people do not know about that. So the KDCA should be in the center of that information, along with many specialists. So every day they should announce anything regarding adverse event in vaccination. So then people will trust the government and would follow or compliant to get vaccinated.
Right, make sure that information is delivered as transparently as possible. Professor Chung, a US congressman recently tested positive for COVID-19 after getting both doses of the Pfizer vaccine. Now, he was reportedly asymptomatic. What are your thoughts about this event?
Yeah, it's just one episode, and I don't think it would affect our vaccination planning in Korea, and it shouldn't, because nothing is much known about that. But even though the Pfizer vaccine can prevent 95% of whole vaccinated people, the 5% do not have any effect with vaccination. So the congressman might belong to that kind of a group. And the other thing is the continuation power of antibody with that kind of vaccine. So 95% is just immediate after result. So we are expecting 6 months antibody tracing report may be coming in May or June. So in that case, if 2 months or 3 months have elapsed after second dose of vaccination, you cannot expect 95% of prevention rate. The prevention rate should be decreased. It's a matter of course. Any kind of vaccine, as time goes by, you can see a decreased amount of antibody in your body. So we'll see. Then we can tell that kind of vaccine, the Pfizer vaccine or Moderna vaccine, is very highly preventive or sometimes missing many people and cannot prevent getting COVID-19.
Right. Dr. Kwak, do tell us a bit about AstraZeneca's vaccine, which has been receiving quite a bit of attention with regard to its efficacy for those aged 65 and above.
Well, that whole subject is mainly due to a mishap of the originally planned third phase clinical trial that was carried out by AstraZeneca themselves. They happen to have lacked the numbers of participants that were above 65. So that's why all these news and talks about whether AstraZeneca is as effective to the older people as it is to younger generations is true or not. I believe, it's just my personal prediction, that it is going to still stay the same in regards to efficacy as it was shown in the second phase of the clinical trial. But we just don't have the proof of that yet. So we're not in the safe place to actually start injecting all these elderly people based on only a few hundreds of people from the second phase of the trial. The third phase trial, the addendum to the original one, is still currently being taken place. So we would have to see what comes out of that. But in the case of our country, though, we're at a quite emergency situation here. We need to get as many people inoculated as quickly as possible. If we were to have choices, I would obviously prefer to inoculate people that were much more proven to be much more effective in all the generations. So I would personally get my hands on those first, and then go on to the less proven, maybe less effective. But if we have to choose, if we have no other choices, but then the AstraZeneca ones, I think in a very emergency situation, really, we would, in a case where we would really have to inoculate elderlies no matter what, then I would say, because of the safety results that was proven by the second phase of the trial, I think it can be done without too much of a concern at that point.
Right. Meanwhile, Professor Chung, production problems of vaccines have led to delivery delays overseas. Do you see this reality as affecting Korea's vaccination campaign?
Yeah, maybe. Regarding a COVAX facility, it's about all the countries on Earth. So either rich or either poor, even distribution of COVID-19 vaccine is the purpose of COVAX facility. So I don't think government should rely upon on COVAX facility vaccines. But ironically, we are having a first vaccine from a COVAX facility. Only 60,000 people will get Pfizer vaccine from COVAX facility. But we have lots of contracted vaccine on our hand, not on our hand, but on the contracted paper. AstraZeneca, Pfizer, Moderna, and Janssen. Sums up 46 million people could be vaccinated with 4 contracts. And there is another contract with the Novavax, which covers 20 million. So that sums up 66 million. So if there is not a big disaster with any kind of vaccine, then we can cover all the people in Korea. So I don't worry much about the amount of vaccine, but as Dr. Kwak suggested, the timing is very important. I wish we could have a whole vaccine on the first half of this year and get all or have an antibody, but things will not be flow like that. So we'll see, and I hope until the end of September we could make a whole population, more than 70% of population get vaccinated until that time.
There's also the hope of the authorities here, right? Yeah. Dr. Kwak, there has been a case of a South African patient being reinfected with the coronavirus variant after his first bout with the disease earlier on. What are the implications of this finding?
Well, I did some research online about this case also. It seems like there's a case actually out of Brazil that was originally infected a couple months back and then is now newly infected with a new variant, mainly that's sprouting from Brazil. And I think they have a shared mutation called B1531. That also happens to be in the mutations for out of South Africa. It's quite concerning because it seems like the recent studies that were trying to see if the original antibodies from the infected people or the antibodies created from the vaccinations or even antibodies created from monoclonal antibodies were quite effective towards these new variants. And it seems like they are eluding. Not as effective as they would be to the original variants. So that is concerning. But the good news is that they have found, even though the vaccinations, antibodies created by the vaccinations were less effective, they were still effective to eradicate the virus within a cell. To my number, the number was exactly a sixth of the efficacy as it would be to the other original variants. However, they are much more concerned that, so thinking in scientific terms, monoclonal antibodies are morphologically very specifically designed, as opposed to vaccines create a very diverse types of antibodies towards a certain parts of the virus. So it could be inferred that vaccinations would create much better antibodies than the single unit monoclonal antibodies. Now, there is another recent study that proves a particular company's double monoclonal antibodies were more effective than the other companies. So I'm hoping for the better results. But at this time, this more specifically, the B1531 new variant is quite concerning and further emphasizes why we need everyone to get vaccinated so that the whole population will be immunized, no longer transmitting towards each other.
Right, and hopefully that will be the case in the near future. All right, Dr. Kwak, as always, thank you for your thoughts. And Professor Jung, thank you for being with us today.
Thank you.
Thank you.
Right, authorities believe we are currently standing at a crossroads with regard to COVID-19 containment and are thus calling for continued vigilance to curb the contagion. Thank you for watching. See you on Tuesday.
Lately, COVID-19 has been spreading through contact with